Hi guys, welcome back to my channel. Thank you so much for joining me today. I'm absolutely excited to have you guys back here. My name is Ore. I am a pharmacist who is licensed both in the UK and in Canada. And on my YouTube channel, I share all things pharmacy, career progression, relocation, living in Canada, what life's like, and all those great things. First of all, before we continue, I would like to remind you that if you are new here and you haven't subscribed, make sure you do. You will get all great content on relocation, pharmacy lifestyle, what it's like to be a pharmacist, what it's like to earn money in North America versus any other place in the world, and just different tips. I generally bring people on here to share their journeys and their stories on how they became the success that they are. And it's just a great place to learn and grow in your career and in your profession. Today, I have the amazing Stacey D'Angelo. Stacey D'Angelo is a pharmacist and founder of yoursimplehealth. She works directly with patients to help optimize, streamline, and reduce medication usage. She specializes in pharmacogenomics, which is such an interesting topic, interpreting how your unique DNA influences your response to medications and deprescribing. She helps patients to safely and effectively taper off medications that are no longer serving them. She brings together her knowledge of medication, entrepreneurial spirit, and a passion for holistic care to this innovative practice. Since graduating from the University of Waterloo School of Pharmacy in 2012, Stacey has had a windy career path encompassing diverse roles. She started her practice as a clinical pharmacist in long-term care and was heavily involved in advocacy as a board director for the Ontario Pharmacists Association. She has had several entrepreneurial endeavors, including previously owning a compounding pharmacy and clinic, as well as working as a consultant developing educational content for pharmacists. Beyond her professional career, Stacey's personal prescription for a fulfilling life includes generous doses of family time, regular beachside strolls, and adventure-packed travels. Her passion for her work is only rivaled by her love for creating cherished memories with her two young kids, Nico and Karina. I'm so excited to have Stacey on with me today. It's going to be such a great conversation. Make sure you stay tuned. Hi, Stacey. Thank you so much for joining me. It's so lovely to have you here.
Thanks for having me.
So do you want to tell the people just a little bit about yourself, a fun fact?
Oh, sure. Fun fact. So scuba diver.
Wow.
Scuba diving around the world. I haven't done that many dives, but very cool places. So I've been scuba diving in Fiji and Maui and Dominican. And so, yeah, little fun fact.
Oh my God, that's amazing. So like, how did you get into that? Was it something that you've like done when you were younger, or how did you kind of like get yourself into that?
No, not at all. When I met my now husband, he had been diving for quite a while and had done some really adventurous trips. And so he got me into it, and I got my certification here in Toronto. And then, yeah, we made some awesome trips out of it. So I love to travel. So it's a great way to pick a cool destination and go out and do something.
That's so cool. That's actually really interesting. And I love that. I think it kind of like links into some of the conversation and discussions we'll be having today, just about diversifying yourself as an individual. So you're a pharmacist. So like, how did you decide that you wanted to do pharmacy? And what was your educational journey into that career look like?
Yeah, so I love that you left off with that, because I totally agree. There's so many different opportunities within pharmacy, and I think my short 10-year career so far has been a testament to that, because I have had quite a windy road in terms of trying different career paths to bring me where I am today. But yeah, I come from a family of pharmacists. So both my parents are pharmacists. I literally grew up in a pharmacy, like helping clean the shelves. And, later as I grew up being a pharmacy assistant, and my mom was in long-term care. So in a specific long-term care pharmacy. And to be honest, at that time, I never would have anticipated I would have become a pharmacist, because I hated it. I hated it so much. But as I went to university, I knew I wanted to do healthcare. And when I learned more about the opportunities in pharmacy that you can get into, education and research and clinical pharmacy, which I had never really been exposed to working in the pharmacy as a kid. Yeah, I just thought it was a great career path. So I ended up kind of going for it. And yeah, that's kind of how the career path started. But yeah, if you would have asked me as a teenager, I probably wouldn't have come up with this answer.
Wow. Wow. So I know there's something I want to touch on before I kind of dive in a little bit further. So obviously you went to school in Canada. So a lot of my audience, people are from different backgrounds, and many of them are international graduates wanting to come to Canada, or some of them might be like, kind of teenagers, maybe wanting to study university in Canada, sorry. So what was the process like in Canada to kind of get into pharmacy? Do you go straight into pharmacy school, or what does that look like for you?
Yeah, so I will preface this by saying I started pharmacy school in 2009 and graduated in 2012. So I know the process is a little bit different now.
Mhm.
But yeah, at the time where I started, you needed at least 2-year prerequisite undergraduate. It doesn't have to be a full degree, but it has to be at least certain courses that you have to get into pharmacy school.
Yeah.
I also attended the University of Waterloo School of Pharmacy,
Mhm.
which is a co-op program, and
Mhm.
particularly at the time they had a different entrance qualifications. For example, you didn't have to do the PCAT, whereas you did in the past for other
Oh,
schools across Canada.
yeah.
They had a pretty in-depth interview process, and I'm pretty sure they still do to this day, where they actually have your peers, basically pharmacists who are out there practicing, coming to interview the future of pharmacy, pretty much to interview.
Mhm.
So a big part of what I liked about their program was they look at not just your marks on paper and how you perform on a test, but who you are as a person, and why do you want to do this kind of thing. So yeah, so that was my experience, and I'm glad that I went there.
So one of the things you mentioned is that you had a bit of a windy career path and career
Mhm.
journey. And I think sometimes, again, going back into, I'm thinking of myself as a pharmacist, and my mindset and how I've been kind of, how my mind's been tailored has always been like, it has to be a straight path. I have to know what I'm doing. I need to know the next step. And
Mhm.
sometimes we get scared as pharmacists, or even like people in the medical field, when like we don't know what's next, or we don't know like how things are going to pan out. So like, talk us through a bit of that. Like, how did
Yeah.
you kind of get through those windy seasons, and how did you kind of like navigate maybe not knowing what next steps look like, or maybe not, fully knowing what you want to do, but not knowing how you will get there, and
Yeah.
how you kind of navigated that?
Yeah, totally. I definitely feel as a person, I've open to opportunities and tuning into my intuition as to like what feels right to get what I want out of my career at this point in time, and knowing that
Mhm.
there will be doors open in the future. So um, for example, I started my career as a clinical consultant in long-term care, which I said, looking back to my high school days, I hated long-term care, but that was working in operations. So in the pharmacy, where working as a clinical consultant is different because you're out at the homes, you're working with nurses and doctors at the homes. And yeah, I really got a lot of value at that, especially being a fresh grad and wanting to use
Mhm.
my clinical skills.
Mhm.
After a couple of years doing that, I again kind of checking in with my intuition. Something I've always wanted is to own my own pharmacy.
Yeah.
And I really did miss the like patient interaction in community pharmacy. So I had to make a decision to leave this, what was quite frankly kind of a cushy job. It was like flexible, good
Yeah.
benefits. It was, like 30% work from home, which was not really done at that time. So I had a lot of autonomy, which I really liked.
Mhm.
Um, yeah, if I wanted to achieve my long-term goals of owning a pharmacy and being in community, I had to take the dive. So I actually decided to do relief at that point, or
Mhm.
locum work as a pharmacist. And I did that full time for a couple of years and kind of like incorporated and decided
Mhm.
to, work. I kind of did it through my own. I didn't work through an agency, but I worked at a variety of independent pharmacies around kind of southwestern Ontario.
Mhm.
And that was a great experience. I would definitely encourage,
Mhm.
like, especially new grads or people just, coming to Canada, to at least do some relief even on the side, because it
Yeah.
does give you some perspective as to like what the good and the bad of different community pharmacies, and you can take for your own practice wherever you go, the
Yeah.
good.
Yeah. Yeah. I
So,
think one thing I was actually going to say with regards to that, just relieving, I think it's something that I've always done, even when I was in England, and it can be scary sometimes, to be honest. Like
mhm.
when I came to Canada, I was very like, oh my God, I'm new here. Even though I'd been a pharmacist for 6 years already, I just, you don't know what to expect. Like you said, you go into different pharmacies and you're like, okay, I don't know if I'm going to get an assistant today. I don't know if my assistant's going to be efficient. I don't know what the patients are like. But as you said, you can take the good And and the other thing as well, I find when you're locuming or relieving is I normally like to go in and say, this is how I do things in terms of like being the pharmacist. And as the pharmacist, you're generally the person that leads kind of the day and how things go. And yes, every pharmacy is going to have their own way of operating, but at least you can say, okay, I don't agree with doing so and so, and maybe we can hold off until the regular pharmacist is back, and this is how I want the process to go. Obviously not leaving a bad impression, but again, taking control of how the day flows. I like to just do that, but still respect obviously the rules and regulations that each store has. And I would definitely, as you said, recommend people to do that because it helps you to see what's out there. Sometimes you have a bad experience and you think, oh my God, is everyone like this? But then you get to see the good as well. So
yeah. Sure. Definitely having confidence in your abilities, and like not being afraid to speak up for what you are willing and not willing to do. And as much communication as you can have with the owner or the manager or whatever in advance to know what their processes are, what's expected of you and what you're comfortable with, I think is good.
Yeah, absolutely. And I guess going through that, your journey and your process, like, did you reach a point where you were like, okay, I'm not too sure what the next step is for me? And like, did you kind of like, what did you have to regroup and like sit down and plan, or did you kind of just like go with the flow and how things went and then things fell into place? Like, how did that kind of pan out for you?
Yeah, so I kind of, the next step in my journey, I would say I had two things kind of present or going simultaneously. One, I knew I wanted to open my own pharmacy. And over the next couple of years, I had met the partners that I had decided to do that with and really developed a plan to do that, kind of the business plan behind the scenes. And also I was presented with an opportunity to be the director of pharmacy excellence at a brand new banner group to Canada. So they were also a startup in their own right at the time. And I was fortunate enough to be part of their team for the first couple of years and basically helping new pharmacies transition to this banner, all the support we would offer operationally and professionally. So yeah, that was a great experience. It kind of just came and landed in my lap at the right time. And I learned a lot about the business side of pharmacy through that opportunity at the same time. So sometimes you just got to be open to these opportunities that come to you. And if you were so pigeonholed to, want to do X, you may not be able to consider how this fits for you,
Yeah, absolutely. I agree. Like trying new things. And I think I do have a question for you here, just in regards to like wanting to do those things. Some people don't actually know how to put themselves out there, because I think sometimes and this applies to different areas of our lives. Like we want opportunities, but we're waiting for them to come to our doorstep. And sometimes that doesn't always happen. So like, did you kind of just like put yourself out there in terms of like conversations with friends or family? And because you mentioned you have a background of like pharmacy in your family, or was it kind of like actually putting yourself out there, maybe like in more scarier platforms, so maybe like LinkedIn or networking events? So how did you kind of get your name out there for people to know that you were around?
Yeah, I would say just like networking early on in my career. I was active in advocacy. So I was on the board of directors with the Ontario Pharmacists Association and participated in a lot of committees. That was also like, I think committee work, if anyone can apply for that, that's a great opportunity to like just meet people. You never know you're going to meet. And that was definitely for me how that one job opportunity came up. It was just like a great colleague that I had known through the OPA. But also like when I was doing relief, I had tapped on some of the people that I had met through OPA and just said, hey, if you're ever looking for work, I'm available, So developing those like professional connections and networks and then using them, reaching out, and people will do the same to you. And, the more you can reciprocate, the more your professional network will grow, I would say.
Yeah, absolutely. Yeah. So you now own your own business where you help patients and you support them through their medication and health journey overall. And I guess this at the center of your business is pharmacogenomics. And that's such a big and interesting topic. And like I mentioned when we discussed previously, it's a topic that we kind of went through in pharmacy school and we had an understanding of. And I think it's the best way to go as it pertains to healthcare and medicines and stuff. And one of the things you focus on is deprescribing. And that's something I'm really big on, especially as it pertains to one of the biggest issues we have worldwide, which is opioids and opiates and how many people are using those that don't necessarily need them anymore. So talk to us a little bit about pharmacogenomics, what that is, and how you use that to help patients to kind of improve their health overall.
Yeah, yeah. So I started this basically direct to patient consulting business where I help people to optimize, streamline, and reduce medication use.
Mhm.
And through that, the two main buckets of that is pharmacogenomics. So that's that optimized piece, right? I think definitely, as you mentioned, it's highly underutilized at this point. We have the technology, there's tests available. I really think the rate limiting step as to why it's not getting more traction
Mhm.
is like interpretation, right? It's you
Mhm.
all this data, you understand that someone may be CYP2C19 ultra rapid metabolizer or different genes that they may have, but who's going to actually interpret that and apply that to the patient in front of you? And I think, especially in today's world where we're just all healthcare professionals in all sectors are just so strapped,
Mhm.
post COVID, it's just the time and energy is not there to do that and to spend that time. So yeah, so I love to incorporate that with patients and clients, whether they're just looking to be proactive about their health. And, because the thing is, your genes don't change, right? So it's a simple
Yeah.
test, you get the information, and you can utilize that information to, drugs even into the future. If you, for example, go to have a surgery or break a leg, a lot of those opioids and pain medications, for example, are on there, NSAIDs, acetaminophen. You'll get some really good data as to like which medication is more likely to work for you, which ones aren't, and which ones are more likely to cause side effects. So just being proactive in your health.
With the pharmacogenomics, I think it will reduce issues that we have with patients. So I hear loads of people who, like, I'm sure you do as well with your clinic and your work, people who maybe have had no response or bad response to certain medicines. And I think we can always avoid that if we use this method and this tool. So was there like like extra training you had to do or some form of like, I guess background work to be able to do
Yeah.
this essentially and have that qualification?
For sure. I think that's one thing that all pharmacists, we have the ability to learn.
Yeah.
And I think we should really be confident in our ability to research and get the knowledge you need to do a new service or task or whatever. I would say over the past like 4 years, I started doing this in a previous job as well. And so I've basically tried every single pharmacogenomics test that's available in Canada.
Yeah.
And they also, a lot of them, if you're working with them as a healthcare provider, either for referrals or consults, a lot of them provide training. So I kind of started there. I did some training with a few of the different companies, and then there is a lot of resources online that you can learn more
Mhm.
about genomics and how to go about applying it. But a lot of that is taking the data that you get through this test. I think about it almost like blood work, right? You get
Mhm.
results from the test back. Okay, now I think most pharmacists are poised to, like, once they understand what these genes mean and what they do, to be able to look at the alternatives that are available and apply that to the patient, whatever their like chief concern or whatever they're coming in for.
How do you work with like physicians around that? Because obviously in Ontario, we currently now as pharmacists don't have a full scope in terms of prescribing. So how does that work? So say, for example, I'm a patient, I come to you and maybe one of my medicines, after doing some tests, you find that it's not beneficial for me and we actually need to switch to something different. How
Yeah.
will you work with my family physician to basically kind of like ensure that that transition is made?
Yeah. So one of my tenets to what I'm doing now at Your Simple Health is working with the patient's care team.
Mhm.
Um, Even, for example, for deprescribing. So that's safely tapering off medications that are no longer right for the patient. In theory, in Ontario, I could adapt a dose, but I never do because I think it's really important to be working with the patient's circle of care and working with the prescriber. And I
Mhm.
will say to date, so basically what I do, I'm working for the patient, which is kind of
Mhm.
nice, right? Not
Yeah.
pharmacy or any other industry. So my goal is to, identify what's their issues, help them create a plan, and then execute that. And a lot of
Mhm.
it is advocating with their doctors and their care team. So as a pharmacist, I can just write a consult note. I will say, like, all of the physicians that I've interacted with to date are on board. I've never
Mhm.
had any negative feedback or saying, no, I don't want to do this. And I think when you're acting in the best interest of the patient and you're providing the right evidence that's useful for them, like it's kind of hard to disagree,
Yeah,
especially
yeah.
a drug expert who's acting in the best interest of the patient, right?
Patient. Yeah. Yeah. I speak a lot on synchronization when it comes to healthcare teams and providers. And I think one of the struggles I've had is when, like, say, for example, you're seeing a rheumatologist, but you're also seeing a cardiologist, and kind of the instructions given to the patient are so different. And it's just like most patients that come into pharmacists are like, I'm so confused because my doctor said I should do this, my family physician says this, my rheumatologist says this. So and being able to have someone like yourself who's actually, instead of kind of saying, I'm going to change the dose, take 40 milligrams instead of the 60, you're actually communicating with the other healthcare providers to ensure that they are aware, and then they can, kind of take it from there. And I think that's actually the way that we should all be working, and have some form of like oneness to the way we work, so that it reduces stress on the patient, because again, that's obviously their lives and their well-being, and we're all working for them, so we have to make sure that they have an understanding that's not confusing for them to kind of journey through. One of the other things I noticed a lot on, I think it's a conversation that's come up many times, I've seen on many like platforms including LinkedIn, is just the topic on how pharmacists can actually bill patients or charge patients or have their own, I guess, businesses and things like that. And it's interesting because we are actually one of the only healthcare providers that don't do that. So if I go to see, for example, this week I went to see my chiropractor, and I looked at how much they charged me, and I was like, oh my goodness, like this is a lot of money. Obviously my benefits are paying for it, but it's a lot of money. But as a pharmacist, I feel like if I was to say, okay, I'm going to open my own little clinic and, give you direct kind of consultations and things like that, many people will frown on that and be like, well, I'll just go to like my local pharmacy down the street where I don't have to pay a consultation fee. So how do you like navigate that? How do you bring your patients on board? And I guess if you could speak to like how you think we as professionals can start to kind of charge for the work that we do.
Yeah, that's a great point. I think that was actually part of the first work I did in developing this business model, was to reflect and make sure my own belief in my value was strong, because that is the key there, right? Like when you speak about other health professionals and, I see a naturopathic doctor, I pay $250 an hour. I see a mental health therapist, spend $165 an hour.
Yeah.
Or are we not worth at least, in those ranges? And we
Yeah,
are.
we
That's
are.
the truth. We are, if we're providing a service that's valuable to the person in front of us.
Yeah.
And so I think it's just being confident in your value, understanding what value you're providing to the patient, not just like all the knowledge that's up in my head, but what problem am I solving for them, and focusing on that. And then I do hope that, as more pharmacists start doing this and getting into these niche settings and providing more valuable services for patients, the system catches up. Because in theory, like we should be able to provide a receipt to the patient, just like your chiropractor did, that's reimbursed by health insurance. Whereas a registered health professional, and if you're providing a valuable service, you should be able to do that. So I hope in the future, and I hope I can continue to gather data for my own business that can support advocacy initiatives towards that in the future. That's like part of my long-term vision.
Yeah. And I think we're basically, we have the same kind of thought pattern. I think, in the long run, that's what I want to see. I want people to actually have an understanding of the value that pharmacists bring. I've been saying recently over the past few weeks that I think it's actually us pharmacists, it's our responsibility to share more on what we do, which is why videos and conversations like this are so important, but also being able to put yourself out there, whether that's, through LinkedIn or marketing, ways and stuff like that, because I think sometimes the public's understanding of a pharmacist is someone who follows the direction of a doctor's orders, in many cases, right? So I think being able to showcase what we do and bringing that to the forefront is going to help to change that narrative. And as you said, people being able to start things like this and entrepreneurial businesses is so vital in that journey. So what would you say to like people who want to start some form of business, like, how do they go about it? What do they do when they face those? Because it's not all, straight curves and straight lines and stuff. So what kind of advice would you give to someone who wants to start and break into entrepreneurship?
Yeah, I would say, listen to your intuition first and foremost. And go for those opportunities that are available. If you have this great idea and your heart is in it and your intuition and your passion is saying it's right, you need to pursue that. Obviously, do it carefully, do your research, put out a business plan, all of that. But there's definitely opportunities to start and put one foot in front of the other, especially even as like a side hustle or a
Yeah.
part-time gig. Whether that's even doing relief work, that gives you that autonomy and that ability to bring in income as your own business.
Hmm.
Uh, Doing consulting and education or content development. Like there's so many different paths depending on what speaks to you and what you're good at and what resonates with you. But yeah, I think the other thing, kind of speaking to or going back to what I touched on earlier, is like tapping into your network. So don't be afraid to like reach out to someone who's doing something in your space or that you admire, and just like I know I'm always open to talk to others and learn from each other, and just help each other navigate their entrepreneurial journey, because it's not straightforward.
No, it's not. Yeah, and definitely. I think I heard a quote the other day, and it was, if you want to win and really be successful, you can't do that alone. Like no man is an island, like they always say. But this quote kind of like opened my mind up to this kind of, if we want to really do well, we have to do well together, and you need people around you. So it's just finding those people who will help you and push you on that journey, give you the best tips. So how can people find you? If there's a patient watching this, or someone who's like, you know what, I want to find out what works for me in terms of my DNA and the medicines I'm on, how can they find you and where can they reach you?
Yeah, and I would also say for pharmacists too, like especially around the realm of deprescribing, if you don't have enough time to handhold a patient through that process, I definitely accept referrals from pharmacists and other health professionals, so that would be great. You can find me at simplehealthpharmacist.com, and there's a provider page there for healthcare professionals, as well as online at Your Simple Health, Instagram, Facebook, LinkedIn, all the things.
Amazing. Thank you so much. It's been so, so lovely chatting with you today. And I really hope that we can, connect more, obviously on a professional level, but, just on a regular level as well. And I'm hoping that, the work that you started is really going to start to spiral and bring more people on board, because I think this work is so important. I think of some of my patients and I'm like, there's so many things that we could avoid if we just get to the bottom of what works for you as an individual, and really trying to personalize healthcare rather than generalizing it. So thank you so much for what you do, and I'm looking forward to the great things that are coming from your business.
Thank you so much. It's been a pleasure to join you, and all about lifting all of each other up, especially in the profession. So that's great.
Thank you. Thank you guys so much for watching. And yeah, we'll see you guys again soon. Thank you. To learn more about Your Simple Health and connect with Stacey, you can reach her at simplehealthpharmacist.com/providers, or on LinkedIn at Stacey D'Angelo. You can check out her Instagram and her Facebook for her business. I will put all the details in the description box. Make sure that you check her out.